increase the output of our services even more by consolidating on the back end some of the things like HR, human resources. Some departments do billing, those sorts of things that we could consolidate into one office. It will also make it much easier for us to do very focused strategic planning for this group as a whole. And so I think altogether we have a very solid plan, and we're very pleased to see it rolling out now and look forward to great things from this group as we go forward. Another area that I would like to mention is our work on the very serious and sort of overwhelming problem right now in Montgomery County as well as in the United States, which is our opioid overdose problem. We have been very involved in that from the very early stages when back in the fall of 2014, many of the individuals in our police departments and first responders came to Commissioner Shapiro and said, hey, listen, I don't know if you realize it, but we're really having a problem out here on the streets. We are coming and finding more and more people that are either dead or nearly dead from opioid overdose. We need to do something about it. We need to act now. So the commissioners at the time, under Commissioner Shapiro's leadership, formed an opioid overdose task force, and they had been meeting since January of 2015. It's a multi-stakeholder group. This is a multi-stakeholder problem for sure. The group involves law enforcement, the health department, our Department of Drug and Alcohol in the county, community members, people in particular who've experienced this challenge in their own families, and a number of others. This task force has made a tremendous amount of progress. You can see the work on our website at montgomery.org/overdose prevention. Actually, the URL's not up there, but all of that work is there. And we have put educational programs into place. We have instituted across the county drug take-back boxes at, I think we're up to 32 police stations. Why does that matter? Because here in Montgomery County, most of the young people that are getting addicted to opioids start by taking prescription drugs that were either prescribed to them for a procedure or in their parents' medicine cabinets. We don't want you to throw it down the toilet because that really disrupts our water system. But we have these drug take-back boxes now all over the county, 32 of them. This past Saturday, we had a county-wide drug take-back day, and I'm very pleased to tell you that we collected just on Saturday 5,600 pounds of prescription medication. Now, to put that in context, in all of 2015, we collected 7,800 pounds. So in one day, just this Saturday, we got to 5,600, which is great because that means that people are starting to really pay attention. We're getting the word out effectively, and people are responding. So I'm just thrilled that we were able to get to that level of response. Another very impactful thing that we've done is under my, I am a physician. I don't think I mentioned that yet, but I am a physician, and I have been also wearing a second hat, which has been the interim medical director of our health department. And wearing that hat, I wrote an order, it's called the standing order, that covers every pharmacy in Montgomery County. And pharmacies have to participate. At this point, we have 23 independent pharmacies that are participating. And again, you can go on that website, montgomery.org/overdose prevention, to find out where those participating pharmacies are. There are actually now, I believe, 2 here in Pottstown. I'm sorry, I don't know the names right off the top of my head, but I believe we now have 2 here in Pottstown that are participating. And anyone can walk up to the pharmacy counter and they can say, I would like a prescription of naloxone. Naloxone is the life-saving opioid antidote. It is a medication that is not addictive in and of itself. It can take the deadly consequence of too much narcotics, which is that they make people stop breathing, and they can reverse that in literally a matter of a minute or two. It is life-saving. And the best part about it is if the person actually is unconscious for a different reason and you give this medication, you won't do any harm. You won't do any harm. So we're really encouraging anyone that has any concern about a loved one or a friend to get this medication and have it readily available. You only have about 6 minutes before brain damage starts when a person stops breathing. So we've got this standing order now, bless you, across the county, and we've had really phenomenal uptake. We've now distributed I think we're around 200 doses of naloxone at this point across the county. So it's great to see that take up. And we are working to make sure that everyone who gets it through our program gets information on treatment. We have lots of information in a very concise, compact way to encourage people to get treatment and how to go about doing that. So we are continuing to work very hard on this issue. This morning at the other community college campus, we convened a meeting of all the colleges and universities in Montgomery County. We have 23 campuses, 22 college and universities. We had a little over half of those universities with us this morning to learn about all of these things that I just very quickly described to you in much greater detail. And the goal is that each of them will take some steps so that when students start to come back in the fall, they will all have some steps on their campus. Many of them are considering having naloxone on campus. We've offered them mental health first aid training, take-back boxes, lots of things that they could do on their campuses to help make sure that they're prepared in case they see any problems there. So it's wonderful to see a county-wide, very comprehensive effort and focus on this.